Yeah, we got to know if it's working fast, right? So if you're thinking about brain and you're thinking about neurons, like the half-life growth of a neuron is super, super fast. We're in the millisecond range, right? So we should know pretty quickly if we're trending in the right direction, and if we're not, then we either have to change something or not do it, right? So that's a big part of what we do is kind of that proof of concept, is making sure, this is what we found. Here is what we think will stimulate that area the best within that metabolic capacity. And then we put it to the test. And if it works, then we'll see a change in our diagnostic tools. If it's not working, then we got to do something different. And I think it's humbling sometimes, because sometimes you don't nail it the first time. But I think it's super useful, and I think it's the right thing to do for people, rather than getting, down the line and going, I don't know, I hoped it would be better.
I think having that objective data is huge for patient education, but also making sure you show patients that they're getting better. A lot of times patients with vestibular dysfunction don't feel like they're making progress. They don't celebrate the small wins. They don't notice when things are slowly trending better. And it's not until you really challenge them in the clinic or show them some objective data that's significantly better than it was at baseline that they go, oh, yeah, I was able to bend over earlier today and not feel like I was going to fall over, and it starts to click into place. So that kind of information and those tests and those diagnostics that are super duper important for just getting people into recovery and feeling better.
And it's good to have a scorecard, right? So if you're good at something, you kind of want to keep score, right? If you're a good basketball player, you want to keep score. And I think that's okay. I think that helps keep you on track for people, and rather than just kind of showing up and going through the motions. But like, it's good to know when you miss, so you can figure out how to hit it next time. And I think that part's super useful too.